Good evening, and thank you for joining us here on BlackDoctor.org. I am Ellis Dean, the Director of Digital Programming and Production here at Black Doctor, and we have a wonderful, wonderful show with you tonight, or for you tonight. So I hope you're watching. I hope I can see you. I wish I could see you, and I'm making those puns, those dad jokes, just because we are talking about vision health and vision safety. So, with our friends over at the Center of Vision Equity Alliance, as well as Prevent Blindness, and so we've got wonderful, wonderful partnerships. The National Eye Institute. So, thank you to all of our partners that have helped us put on this program for you tonight. And so tonight is all about eye injuries, right? And so I learned a quick factoid before when we were planning for this show. I learned that there's 2,000 eye-related work injuries every single day. So think about that, 2,000 per day. So you multiply that out times, 365 days in a year. Think about how many eye-related work injuries there are. And that doesn't even include the sports and recreational. Say 40%, I think it said 40% of eye-related injuries are due to sports and other recreational activities. And about 10 to 20% of those work-related injuries result in some sort of temporary loss of vision or a permanent loss of vision. So that's why we're here. This is a serious matter, and we've got two wonderful, wonderful specialists here with you to talk about eye injuries, how to prevent them, and what you should do if you happen to have an eye injury. So before we begin, you know what we like to do before every show, we want you to let us know where you're watching us from. So if you just reach in that, type in that comment section where you're watching us from. We like to see where people are watching us from all over the country and all over the world. So drop that in the comment section. Number two, if you know somebody that needs this information, please, please, please tag them, share this program so they can get this much needed information, so we can share this around so people can protect their eyes. And finally, if you have a question, as we're going through tonight's discussion, if you have a question related to eye safety and eye injuries, please put those in the comment section and we will get them asked within reason. We will get them asked to our specialists this evening, because we are here to answer your questions. So I think those are the big three. So let's get started. So I'm going to introduce you to our specialists tonight. They are fantastic. It's amazing the amount of where we get people from. It's just fantastic. So first up, we have Dr. Fasika Wareta, MD, MPH. She got the alphabet soup going on. She is at Johns Hopkins University School of Medicine. That's right. I said Johns Hopkins. Okay. All right. And she is the director of ophthalmology residency program, and she is an associate professor of ophthalmology. So that means she's teaching people how to take care of eyes. So she's got to be, when you're the teacher, you're somebody special. And we also have Dr. Keith Carter, MD, FACS. I don't even know what FACS is, but I know it's got to be something special. And he is the University of Iowa Hospitals and Clinics. He is professor of ophthalmology and visual sciences and cosmetic surgery and services. So, he's teaching people too. So we've got two teachers here with us this evening, and I'm going to bring them on camera with here and welcome them both to this program. Welcome, Dr. Retta and Dr. Carter. How are you doing this evening?
Great. Thanks so much for having us, Ellis. I'd like to also thank Prevent Blindness and the Children's Vision Equity Alliance for letting us talk about this really important topic.
Absolutely. You're right. It is a very important topic. And it was funny that, I'm going to be a little bit personal, a little transparent here. I've played sports my whole life and never even thought about eye injuries and need your eyes. Like, to play sports, most sports, you need your eyes in a very significant way in order to play them successfully, but you never think about injuries, with baseballs, particularly with bats flying around, people, we were talking before the show, football and those scrums, people poking at people's eyes and don't realize that what that damage could do, both in the short and the long term in terms of their eye health. So I guess my first question is, and I'll throw it to Dr. Wareta, then Dr. Carter, you can answer. What are the most common types of eye injuries for adults?
So there's many causes of eye injuries. And so as you mentioned, you've been playing sports all your life and never had an eye injury. So for those of us who care for patients with eye injuries, we know that, when you have eye injury that affects your vision, it can really be devastating for your entire life. So it's really an important cause of vision loss in the U.S. So we do want to prevent it. So what are some causes of eye injuries? Some frequent causes in adults are falls. So you have for elderly, falls is a big cause of eye injuries. Also, sports injuries, as you discussed, as you mentioned, 40% of eye injuries are caused by sports. And then another one is assault. So unfortunately, as you mentioned, I'm at Hopkins in Baltimore City, so we do see a lot of assaults affecting the eye. So as we'll talk about throughout our session today, prevention is really the key strategy, and 90% of eye injuries are preventable. So we'll focus on that throughout the session.
Dr. Cole?
I agree. And I think one of the issues that a lot of times we forget to protect our eyes. We just take it for granted until we have an injury. There's a lot of ways we can protect our eyes, but it's really hard to get people to wear eye protection unless everybody wears eye protection. So you talk about sports. If we can get leagues to require eye protection where it's cool, then the kids would do it. But you can't ask one kid to wear eye protection, the rest of the team doesn't.
That's a very interesting point, because you're right. I think kids, and I see my son plays baseball, and what's funny is they've got the ankle protector down it. They've got all the arm protector, the sliding glove. They got all those protectors, but nobody thinks about protecting their eyes. They got the helmet with the jaw protector, but their eyes are just wide open. And you're right, because all of those things are cool. They see their favorite players wearing all of those other things, but they don't see them wearing goggles. You may see one or two, but they say, oh, those are prescription, and they kind of, and not even thinking about, hey, there's potential this ball could get hit the wrong way. This bat could slip out of somebody's hands, or just if I walk into and somebody's swinging a bat, if I walk in the wrong area in their bat radius, I could catch their backswing and not even know it and get hit in the eye. And so when you see that, when you hear that figure of 40%, you're like, wow, we're just in our day-to-day activities, things that activities that we enjoy, there could be some serious eye injuries. Dr. Carter, I know you are focused, your specialty is that area around the eye, like that orbital bone. And I hear those things from time to time, but how serious and what are the ramifications if somebody has an injury to that orbital bone?
Well, I think sometimes we lose track and focus on the bones around the orbit, but what's more important is the force that hit the eye that caused the bone to break. That same force hits your eye and causes an increased pressure in the eye itself, and you can have damage to the eye itself, but the damage to the bones or around the eye are important also. And they're important mainly because if you can get tissue around your eye stuck in these breaks, you can't move your eye well. And if you don't fix that in sort of a urgent way, you can have permanent loss of motility of your eye and have double vision. But so more importantly than the bone fracture is actually the force of whatever injury, how your injury occurred, is really the force that hits your eye that I think people lose track of sometimes. So you need a good eye exam before you worry about the bony injuries.
And if you can imagine a baseball, as you said, which is a common cause of sports injuries, baseball, basketball, the force, usually it's going at 50 miles an hour. So as Dr. Carter said, in addition to affecting being powerful enough to affect, to break the bones around the eye, it can cause significant damage inside the eye, bleeding inside the eye, which can lead to loss of vision. It could also lead to problems with the retina, like a retinal detachment, which can lead to loss of vision. So, and it can also rupture the eye wall. So, it sort of causes, it's like a sort of a blowout of the eye with that velocity. So it's kind of scary. As many people as we have children playing sports, most of them are not following the eye protection standards. So there's like designated sort of prescribed protective wear, there's standards, but most people do not wear eye protection of those standards that are recommended by the American Society of Testing and Materials.
Well, that's unfortunate. Speaking of children, I know we've talked about sports a lot, but are there any other common causes for eye injuries in children?
One common cause that I see frequently are dog bites. We
Oh,
love
wow.
our dogs and our pets. Uh, Occasionally, children will do something to a dog. It could be their own dog. More than likely, it's a dog they know that's not the family dog. It may be grandmother's dog. And they'll do something to the dog, and the dog will bite. And oftentimes, I feel sorry for the dog because I know normally dog's not biting, but something happened.
Right.
But still, it's no excuse for a dog to bite a kid. The children are at a good height for dogs to bite, and a
Mm.
lot of times eyelids are affected. Luckily, they don't damage the eye often because of the angle in which they bite. They try to bite along the jawline of the face, but they can grab the eyelid and rip it and tear it. But I've seen a lot of pretty bad lid injuries, but the eye was okay.
Oh, wow.
Absolutely. We also see chemical splashes in children. So you want to make sure they're supervised. For example, if you have bleach splash into the eye, that can be absolutely devastating. And it can affect both eyes, and it leads to loss of clarity of the window of the eye. So that can be a lifelong thing that the child has to deal with. And also, Fourth of July was a month ago, and I saw kids with sparklers. So every Fourth of July, we do see injuries due to home use of the fireworks, such as sparklers, causing devastating injuries. So that's another common thing. And then finally, around the holiday time, we do see some injuries with sharp toys, or the things children may get for the holidays, like BB guns, very, very dangerous toys. I remember one Christmas I was on call, and a child was opening a gift with a knife, and it went into and injured the eye. So really making sure that when children are around sharp objects, they're not around sharp objects, and there's really close supervision, because again, this can be something that affects the rest of their life, their ability to pick an occupation, for example, or drive. So
Wow. Okay. So we got sports, dog bites, um, chemical spills, and that's probably one of the most preventable. So move those chemicals. I know my grandmother's house had everything was underneath the sink, right at the child's level. So parents, I'm telling you to move it up outside of the child's reach, especially those dangerous chemicals like ammonia, bleach, any of those dangerous chemicals. Move them above, outside of the reach of your children. So those are some of the most common causes of eye injuries, particularly in children. And you think about the younger the child, the more, if they're starting that early in life and they've got some sort of eye injury that's going to impede, that's going to impact them. That's a long time for some sort of blurred vision, and you don't want that. You don't want that anywhere for anyone, but just really for a child that might be 8 or 9 years old and having to deal with that their whole life. That can be devastating.
I think
So,
another thing you got to think about also are sharp objects. Depending on the age of the kid, things like scissors, pencils,
mm,
pens, crayons are a lot safer because they're more blunt. But you just have to be careful with those objects because they can fall on them and injure the eye, or they can accidentally poke themselves in the eye. You think no one will poke themselves in the eye, but it happens.
yeah.
So you just have to be careful on the age of the kid what you allow them to play with.
yeah, rubber bands, elastic bands, all of these things can cause eye injuries. And you mentioned, Ellis, like for example, if the injury happens when the child is really young, like before the age of 6, then their visual system does not develop normally, and so you really have to be careful in very young kids, because it can lead to lifelong disability in them if it happens at a very young age. So even if you can do surgery and fix how the eye looks, if their visual system doesn't develop, they develop sort of permanent deficits.
Yeah, you're making a very good point, because I think there's a kind of common misconception that once the child is born, they're just growing, but all of their systems are fully developed, and that's not. We know their the brain develops all the way until our early 20s. We're talking about eye development at early, early elementary ages, and we're still developing. And so, any type of disruption to that development can have lifelong implications. So I think that's a really good point that you're making. So we talked about, what about those workplace injuries? Like, we know that there are a lot of people, particularly Black and brown folks. We have more jobs that are frontline. We saw that during the pandemic, where even here at Black Doctor, we had to, while the rest of the world was telling people how to work from home, we were telling our audience how to work safely during the pandemic, because you had to go back to work. There's a lot of bus drivers and transit drivers and hospitality workers and things like that. They have to go physically be in their jobs. So what about those workplace injuries? What are the most common types of workplace injuries? And should, I guess should is that's the toughest question, because now we're talking about what people should be doing. But what can workers, what can employers be doing to keep eye injuries down at the jobs?
And so
I think enforcement of eye protection. That's the most important they can do, that the employer can do for their employees, is to protect their eyes. If that's in place, doesn't mean you can't have an eye injury, but usually eye injury is less severe if you have some protection. Polycarbonate lenses, which are shock absorbing type material, is the same thing they use in the hockey masks, so they can withstand a puck. You're going to protect your eye if you get hit with a puck. I mean, that material is pretty strong. And if you have good sturdy frames in the glasses, you're probably protected pretty well in the workplace. Workplace injuries are very common because a lot of times people will take their glasses off. It's interesting how many times people take their glasses off and that's when they get injured. And it's just ironic. But in the workplace, that happens, especially if you're around machinery or anything where people are moving objects around you. You could turn into something that's being moved around you. They're not aware something's moving, and you turn into a box, or you turn into and you get a cardboard cut or something like that. I mean, those are all workplace things that you could prevent if you had eye protection.
Absolutely. And like Dr. Carter says, 9 times out of 10, when we see these workplace injuries in our emergency departments, our patient was not wearing glasses for protective wear for whatever reason, whether it be they lifted it up or weren't wearing it that day. So I think, as we said, that's the most important thing. Again, 90% of these eye injuries are preventable, and you can see some superficial injuries as well as more serious ones. For example, sometimes you can see like a piece of metal or debris stuck on the surface of the eye. So if you do develop, for example, if you're working and you have a feeling that something's in the eye, don't ignore it, because sometimes when the patients come and see us, we'll actually see the metal lodged in the front of the eye, and we can remove it. So you don't want to wait and then have it develop into an infection, for example, or you can get rust around the metal. So I would say, if you have symptoms that persist past a few hours, and come and see us. And then, as Dr. Carter alluded to, you can also get much more severe injuries. For example, with sharp tools, sometimes they do actually cut the front of the eye. And then that is a surgical emergency. So you also, you want to stop, shield the eye, and get to the nearest emergency department so that we can take care of the emergency.
I noticed, from my, a 1,000 years ago when I was taking science at school, particularly in the lab, they would have that contraption over there for like when chemicals get into the eyes, and you'd have to hold your head over, and if anything got on the face, you'd have to hold your eyes open and wash them out. And so, is that recommended? Or, because I know the typical response for us lay folks is something gets into our eye, immediate reaction is hand goes to the eye and we start rubbing. But it sounds like from your example, Dr. Warretta, that's not the best thing, because we could just rub that piece of metal or whatever that's in our eye and do more damage by rubbing it around than just stopping and trying to do something more preventative. So what are some of those steps you mentioned? And maybe if it's a chemical, they rinse it out. But what if it's a sharp object? What should they immediately do?
Yeah, so chemical injuries are a special type of injury. So that is where seconds really matter in terms of how you're going to do. So if you have a chemical splash into the eye, you want to stop immediately and begin irrigation with any liquid that you have. So you want to copiously irrigate with water or, again, any liquid, because chemical injuries, again, seconds matter, and the chemicals are actively doing damage to the eye. Every second they remain in contact. And then, so that's where you don't want to wait and go to the hospital. You want to begin irrigation on site immediately. And so that's a sort of a different example. And then in terms of the sharp objects, if you have that, that's where you want to stop, shield the eye, even if you can use the bottom of a styrofoam cup to shield it, and then get to the nearest emergency department where an eye doctor can assess the injury. But for chemicals, you don't wait. And I think most all sort of eye hospitals and on the field emergency personnel are trained to irrigate. And if it happens to you, irrigate yourself, because again, every second that the chemicals in contact with the eye matters, and it can literally destroy within minutes if not irrigated.
Oh, wow.
I think what's important there also, when you're talking about irrigating, everybody thinks it's just water. In general, if you're not near an emergency place, anything you can probably ingest is probably safe enough to put in the eye. So, Gatorade, I mean, any fluid at all is good to irrigate with. So don't feel like you have to have clean water. You don't have to have clean water. And the other good thing with foreign bodies in the eye, most people don't rub long because it hurts. And pain is a deterrent. So people will stop rubbing if it hurts. Right. So that's a good thing. And then, protect the eye and get to the emergency department so somebody can take care of it and take a look at it.
One of the things you mentioned earlier, Dr. Carter, was, and both of you talked about that pressure, like when you have like a baseball or a bat, is there a threshold of pressure that is going to cause damage? Is that like 10 pounds, 20 pounds? Is there a threshold that we need to kind of pay attention to? I mean, I know if I turn to somebody, elbows me inadvertently, there's going to be some pain, but that may not be enough to cause an injury. So what is that threshold that can go from, hey, there's some pain there, I got bumped in the eye, to that pressure is to the point where I need to go see urgent care or go to the emergency room?
I think if you get bumped in the eye, it's not so much how much pressure, because most people are not going to be able to determine that. But if your vision changes, I think you should go get seen. If you have severe eye pain, you should go get seen. The injury where you have something that's larger than the entry of the orbit, where the object hits your face and it pushes your eye back into your orbit, that generates pressure in your orbit that breaks the bones around it.
Okay.
And then your eye expands back. That energy that's directed to the eye is what I think is more important than those bones breaking. You can also have a direct hit on the bone and break it. Those are less common. But I think anytime you experience decreased vision, pain, double vision, anything that's abnormal, you should go get evaluated. Not the next day, not after you go to McDonald's. Go. We laugh. That's a very common thing. We want to take somebody to the operating room. They stopped at McDonald's on the way in. So don't stop at McDonald's. Just come straight in and let us see you.
It's sad as you have to say that, but I know it. I know it's true.
It's common. It's very common.
People are hungry. They know they're gonna have to wait in the hospital.
Yeah, that's right.
Absolutely. And some people, in terms of the decreased vision, they don't really notice it. So you want to cover your good eye and see if the vision's affected, as Dr. Carter said. And I think we do see patients come later, maybe like 48 to 72 hours after the injury. And if you have a serious injury, the earlier you get to us, the better. So don't ignore the symptoms. And seek care right away, because it can affect the final outcome.
And if you have a young child and they won't let you look at the eye and they just keep the eye closed, they should be seen.
Yeah. Anytime you don't let them touch it, that's a problem. Right. So we got. So if you're just joining us, we're here with Dr. Beretta, Dr. Carter. We're talking about eye injuries and eye safety. So we're going to be we categorize one of kind of the most common types of eye injuries that happen in adults and in children. Workplace, we understand that 40% of eye injuries are due to recreational activities. So if you got your weekend softball game, put on some goggles and keep your eyes, especially y'all weekend warriors. Y'all really the pickup basketball game, an inadvertent elbow, uh, softball, pickup football, all of those things that we're doing. Um, Enjoy yourself, have fun, but think about protecting your eyes, just like you think about putting that ankle brace on or that knee brace on to protect those joints. Put something on to protect your eyes, because again, they are, for most of us, they're a vital part of our employment. So we need to keep our vision as healthy as possible. We got a couple of great questions coming in from our audience. Vicky is asking, I often wonder about the children, adults paintballing. That seems so dangerous. What are your thoughts on paintball?
Paintballing is very dangerous. Most people do wear eye protection in paintball, but the paintball injuries I've seen occur after you get hit and you take your eye protection off to clean it. Please duck behind something, because that's when you're going to get hit. So you had it on, you got paint on your glasses, and you're going to take it off so you can see. That's when you have a chance to get hit and injured. And I've had 2 patients that got eye injuries during paintballing because they took the glass off the wipe. So if you're going to do this, make sure you take your glasses off. You're hiding behind something to do that. Don't expose yourself.
Right.
But for whatever reason, your luck is bad, you're going to get hit.
Yeah, absolutely. And so I have a 4 and 6 year old boy, and there'll be no paint guns, air guns, BB guns, because we see these injuries, so they can be very dangerous. And like Dr. Carter said, if you have to do it, then definitely make sure they're wearing eye protection. But they're really dangerous. Also, bungee cords, we see really bad injuries from it snapping back and hitting the eye. So
Oh, wow.
yeah.
Well, yeah. I'm gonna go get me some goggles right after the show. All right, we got another question from Vivian, who's watching on YouTube, and she's asking, "What about red spots in the eye? Blood vessels? I guess you're saying vessels damage. What can she do?"
So there's different sort of, as I mentioned, you can have bleeding in the eye with an injury. So sometimes it is just superficial, where it's the vessels on the surface of the eye that so your eye will appear bright red. So it looks scary, but if it's just on the surface of the eye, that's actually nothing to be concerned about. Sometimes you'll get that because of straining, if you're coughing or sneezing, or have just a surface injury, you can get the eye looking bright red. And actually, since it's on the surface, again, that's not concerning. Now, if you have a significant injury with one of the mechanisms we talked about, like significant impact, high impact or high velocity injury with a lot of speed, then you can get bleeding inside the eye, and that will present with decreased vision, eye pain, sometimes headaches. So if your vision's normal and your eye just looks bright red, most of the time that's just a surface burst blood vessel, and actually nothing to worry about.
And I'm going to reiterate just after that, just as you ask your questions, please bring your questions, but please understand that this broadcast is for informational purposes only. This is the advice that's here, and the tips that's here is not intended to replace what you would see from your primary care physician or any physician that you would see in person. So we're just going to give you, this is for information purposes only. This is not to supplant any medical advice that you have received previously or that you might receive in the future by going to see a specialist. So I just want to make that clear, so people don't start saying, "Well, I saw this show and they said," it's like, no, don't come for Dr. Carter. He to give you some advice, okay? Don't come for Dr. Carter with that one. But yes, so that's a great point, because I think a lot of times, and let me put the question this way. At the point where we start having blurred vision, has that mean something has progressed to that point? Have we waited too long to where we're starting getting the blurred vision in one or both eyes after an injury?
I wouldn't classify you waiting too long. I just think blurred vision is a symptom of some disruption to your eye. It could be temporary, or it could be a sign of something more serious. So I think if you have blurred vision that persists, you may have blurred vision immediately after the injury, but it may clear up. But if it stays, you should be evaluated by a physician.
Okay.
Exactly, because a lot of times these injuries will present, for example, if you have bleeding in the front of the eye, it's going to present with decreased vision at the time of the injury. So if you have that, come right away. And then alternatively, like you said, if you had an injury and then you develop blurry vision later on, there can be other causes that sort of delayed causes of blurry vision after an injury. So you also want to seek care of an eye doctor.
Well, I just want to, for the audience that is just joining us, we got Miranda. We're going to get to your question here in next. I just want to point out to people that when we're talking about our bodies and all the different parts in our bodies, eye is one of the most complex, if not the most complex organ that you have. There are 9, count them, 9 different specialties when it comes to eye care. Okay, 9 different specialties. There's not, there's a neurosurgeon, but 9 different specialties for eye. There's so many different parts of the eye that can be impacted by an injury, and so therefore that's why there's so many different specialties. And so we have to take care of our eyes. We only get one pair. That's it. We get one set. And so we've got to do whatever we can to take care of them. So Miranda is asking the question that we were talking about just before the show. She wants to know, did I miss the part about the impact of cell phone and computer screens on the eyes? And so we're talking about workplace injuries. And so workplace injuries could be immediate, where there's a box or a sharp object or inadvertent elbow, you take it off to wipe it and you get hit in the eye, or there's a chemical splash. And then there could be some long-term injuries or damage that could be done by just the amount of time that we're spending, especially now we got children having cell phones, children having laptops and computers. We're looking at screens all day long. The pandemic took that to a whole nother level because we were home and we're using all these different streaming platforms to stay connected with one another, but we're spending a lot of screen time. And I know about that I hear about this blue light that could be damaging our eyes. What impact are those things having on our eyes in the short and long term?
I think for adults who use the screen a lot, I think the most common thing that it causes is dry eyes, because when people are looking at screens, you forget to blink. And usually we blink 100 times a minute. So if you're staring at a screen and not blinking, often we see adults with symptoms of dry eye. So, strain, maybe some headache after being on the screen too long, feeling like something's in the eye. So that's something that we treating the dry eyes, making sure you're taking breaks, making sure your blinking is enough. And then for kids, we know that reading up close is associated with being more nearsighted. So, as you mentioned, with kids' increased screen time, that we did see shifts in the amount of kids presenting with nearsightedness. So, making sure that kids are not on the screen for more than an hour or two, and then making sure they're getting enough time outside to stop sort of the development of nearsightedness is also important.
We do a program with Dr. Joseph Coney, and Dr. Stephanie Marion, who she came on as well, and she talked about the 20-20-20 rule. So I'm going to add my rudimentary understanding of the 20-20-20 rule, which is every 20 minutes, take your eyes off the screen, look at an object 20 feet away for 20 seconds, right? And that will kind of reset your eyes, as well as, and I'm going to add the other piece of it that Dr. Loretta gave us tonight, and that is blink. Okay, just blink. Blinking sometimes is forgotten. You're right, because I'm reading emails, we're responding, we're doing this, we're multitasking. I got 2 screens up right now, plus my phone is over here going off. And so, I want a computer all day long. And sometimes you're right, you do forget to blink, and I have to do I got to rub my eyes, get tired, and that could lead to headaches and other issues. And so follow that 20-20-20 rule. Give your eyes some breaks and some grace, and then blink to keep the moisture on the eyes.
That's it.
So, Dr. Carter, Is there, and you mentioned this earlier, and I'm going to come back to it because I really want people to recognize uh, there is a little bit of vanity that comes into the general population that said we don't want to wear those protective eye gears unless we absolutely have to. So if we're paintballing, you can't go out on the course unless you wear the protective eye gear. But in other cases, or if you're working at a specific job in a factory or something, you have to wear. If you're a welder, if you're working on a similar, you got to have your protective eye gear. But in other cases, in other positions, you know, and especially in all our recreation activities, wearing protective eye gear is more of a cosmetic choice than it is a protective choice. How can we get people to understand that to make it cool to wear eye gear?
The biggest, we'll have the greatest impact when we convince leagues to require eye protection. If you look at the Canadian hockey leagues, the junior leagues, they require all the kids to wear eye protection. And once all this requirement, it's no longer a vanity thing. The hardest thing I have is I have a kid that has an eye injury, a fracture or something like this, and I want to put them in eye protection. And they're playing baseball or they're playing basketball. I have collegiate people right here on campus playing collegiate basketball that had to put in goggles. I had to go down to the bench and enforce the goggle wear because they just didn't want to wear them because they were only on the court with goggles. And you understand it, but because we haven't been able to convince our sports league to protect the eyes, it becomes very hard for a player to participate in eye protection. You've had basketball players do it, but usually it's associated with injury. You have basketball players wear masks to protect a broken bone, but they don't wear anything over their eyes to protect their eyes. It's amazing to me. The broken nose, you can fix that with no problem, but the eye injury is more serious. But it's really, it's not so much the individual. I think it's going to be communicating the importance to leagues and little leagues and development leagues and professional leagues. But if we can get the professional players to do it, then the little leagues will follow.
Absolutely, and it just takes one bad luck, right, where you have one eye injury that can affect the rest of the child's life or the adult's life. For example, for a child, if you have decreased vision in one eye, you might not be able to fly a plane. You might not be able to become a surgeon, for example. You might have to drive with restrictions. And so it really can impact what your child may do. So you see it in the patients when they come in, especially small kids with their mom or dad, and you can see the toll it has on the parents as much as it does on the children. So the emotional toll of these eye injuries. So if we can prevent it by glasses, we should do it. Also, again, proper supervision, making sure they're not near any sharp objects, etc.
Yeah, I tell this story all the time. I remember I was coaching baseball, and this kid, he was a pitcher, and fastball, the kid just hit it right back, and it was aluminum bats. Those bats really spring. He hit it straight back and the pitcher didn't, and it caught him right on the side. I mean, and the side of his face completely, it was green. That's how much it changed colors. It was like, and it was just the hush that came over the crowd, and the worst part about that was his dad was the head coach, and he didn't want to take him to the hospital. He wanted, it's that there's a macho thing that comes into you playing through injuries, and oh, you got hit because they hadn't started swelling yet. So he was like, oh, he'll be okay. He can walk it off and he can get back in the game. And then you realize as it started swelling and changing colors, he needed to go, because and realized that he had a concussion on top of that fracture to the orbital bone, and that trauma made it to the point where he just really was not comfortable pitching again the way he used to be, because when you have something that traumatic happen to you. And so what we're saying here, what Dr. Carter, what Dr. Loretta is saying here, and what I'm trying to echo is make it cool. You be the first one, because it's not cool seeing those injuries, and they've seen those injuries come into their practices, into their offices, into their hospitals. I have one injury that I will never forget, that I saw. And thankfully it wasn't to my son, but it was close enough to where I was like, you know what? This is a serious, serious matter. And we've got to, take care of and protect the kids. And so do what you can. I do agree with you, Dr. Carter. If the sports leagues would make it mandatory, the kids would do it. And that's just,
Yeah. Because it would be the right thing to do, and they think it's cool. The best time I had with eye protection in sports is when, and this is going to date me because probably half the people won't even know who these players are. Kareem Abdul-Jabbar wore goggles and James Worthy wore goggles.
yes.
When they were wearing goggles, I can get basketball players to wear goggles, but few players now wear goggles, so it's hard. It's just a hard sell, and I just had to compromise with them that they were running risk of injuring their other eye or whatever. And do the best you can to protect them and let them know. But that's the best we can do. Best we can do is educate the parents and educate the participant.
Yep, and remember, 90% of eye injuries are preventable. So in our field of eye trauma, really the game is prevention. And not only for children playing sports or adults playing sports, but if you're outside mowing the lawn, like we've Dr. Carter and I have seen countless patients with injuries from just freak accidents, a rock hitting the eye, a tree branch. So if you're doing anything out in any yard work, home improvement, with COVID-19, we saw an increase in the number of injuries in the home. So lots of people doing home improvement activities. So we saw an increase in injuries there. So really, if you're doing anything to, our American Academy of Ophthalmology recommends that you have a pair of the polycarbonate glasses in the house for eye protection. So really, when you're doing any activities that could put you at risk.
Right.
So when you put on your gloves to do your yard work, I'm just gonna make it plain. Put on your gloves, put on your glasses. It's just, it's the same motion. Put your glasses on first, then put your gloves on, and then go do your work. Because I'm thinking about, I'm having those flashbacks when I was a kid cutting all that grass, and just you could roll over a stick, roll over a rock, and it shoots out the wrong way, and now you got an eye injury. And
but the interesting thing is not so much a person operating the machine, it's the people in the yard.
Yes,
that get injured. Is that stick or rock comes out, it could injure somebody. So nobody needs to be playing around a lawnmower.
No,
you gotta move the game someplace else till the grass is cut and then come back. I mean, it's just, you can injure somebody just by cutting grass. Not only yourself, but more importantly, that projectile is going to come out to the side of the lawnmower and hurt somebody else.
Exactly. The kids playing in the lawn and then, get a devastating eye injury.
Right.
Children are the toughest, right? Because when you're talking earlier about your example of in the classroom, and my mother was a kindergarten school teacher for her career, and just thinking about a classroom of 25, 30 kids with pencils and rulers and scissors and all kind of objects and glue and all these different things. Like I'm rubbing my eye, and glue and all these different things and that lower threshold of self-awareness and spatial awareness that children have, it's natural to understand that they're turning their focus on what they're doing and not the person next to them, and they turn the wrong way, and that sharp pencil becomes a projectile. So as schools are opening back up across the country, what are some things that teachers could do to kind of reduce the risk? They can't eliminate the risk in their classroom outside of taking everything out of it and everybody just sitting around with nothing. But what are some of the things they could do to reduce the risk of eye injuries in the classroom?
I think making the kids aware of the potential dangers of sharp objects. I think that's the best you can do. I mean, in a classroom, I've seen a lead pencil go past the eye, through the back of the orbit into the brain. So that's the worst I've seen. And so that's not to scare young teachers or children, but I think you need to let children know these objects could be very dangerous if used inappropriately. So no, they got to learn how to use scissors. They need to know how to write. But I think you do those things as they get older. And like I said, in real young children, crayons are the perfect thing because they're blunt. And it's hard to get that to penetrate. your skin. And I think until they become responsible, they don't need pencils and pens.
Absolutely. I think, as you mentioned, Dr. Carter, it's not, there's no age that's early enough to start the education. Like my 4-year-old frequently runs to the kitchen and tries to grab a kitchen knife. So, first of all, keeping them out of his reach, and then also educating him on the dangers is important. So now he knows that, not to run with scissors. Running in the classroom with pencils or scissors is quite dangerous. And then if the injury does happen, so I think kids often don't want to get in trouble, so they don't want to so I've had cases where they're like, they were just not doing anything but had this injury, which was a pencil that actually cut the eye. So you want to make sure that if the child is not opening their eye, don't ignore them. Take them to the eye doctor. So because I've seen cases where it's been delayed a couple days because the child didn't want to say what happened, and it was obvious that something bad did happen that they didn't want to talk about. So if their child's not opening their eyes, they have a red eye, when they come home from school, do take them to the eye doctor.
Right. Very important.
So teachers, so any teachers that are watching us, create a culture of safety in your classroom, right? So, and you do that by, you can make it a game and talk about the safe ways to engage in each activities. And so kids will lean into that. Create the culture, especially in elementary school where they're spending a lot of more time with one teacher. Create that culture of safety in the classroom so the kids will understand if they're in certain sections, have some eyeglasses over there, have some protected eyewear over there so they know, hey, if I'm going to be in this section of the room, I've got to wear protective eyewear because this is where we've got the pencils and the scissors and and keep that in one area and make that your designated area where it's not spread out, so to keep a watchful eye, pun intended, out on that area as much as possible to try to reduce some of the risks. I think we're making some great points here. So folks, I hope you're taking some notes. And if you have any more questions, please drop those in the comments. We had some wonderful questions earlier on. We just got a few minutes left here with Dr. Carter and Dr. Loretta, and we're talking about eye safety and eye injuries, and really trying to get people to understand. I think one of the major points that we've kind of been threading throughout this conversation tonight is this: eye protective gear. Wear it. Stop trying to be cute. I'm gonna be real with y'all just for a minute. Stop trying to be cute. Put your eye protective gear on. It's what's not cute is a devastating eye injury that could have been avoided. That's not cute. Okay, you can be cosmetic for a little bit, and Kareem looked good running up and down that court, so he's fine. Yeah, you'll be okay. Number two, do not ignore an eye injury, right? So number one is protective gear can reduce eye injuries. Number two, you've got to make sure that if an eye injury does occur, you can't walk it off. It's not an ankle injury. It's not something like that. Don't walk it off. Understand what Dr. Carter said, so those symptoms. Blurred vision. What were those symptoms, Dr. Carter? I don't want to mess them up.
The blurred vision, it makes us worry about an injury to the eye. Mm-hmm. Pain. Yeah. If somebody is in pain, you have to get evaluated. I mean, you just have to. Nobody should be in pain. And the eye is a very sensitive organ. So pain is a nice indicator of something has happened to it. But decreased vision and pain to me are the two biggest things you need to seek attention.
Yeah, and redness, if the eye is red past a couple of hours and persistently red, you should. And sometimes headache also can be a sign that something's wrong with the eyes. For example, if you have a bad eye injury and you have a headache, that could be a sign that the pressure in the eye is up, which can be an emergency. So.
What about like if it's tearing too much? Like, I know we talked about eyes being dry from looking at computers. But what about if something flies into the eye, you get some eye injury, and your eye is continually to tear? Is that a sign that something could be going on with the eye as well?
Absolutely.
Yeah, it's probably a sign that you have something in your eye, and is your body's way of trying to wash it out. So a lot of times people come in tearing. A good eye exam will probably find the foreign body. Either embedded in the eye itself or somewhere underneath the lids that's causing eye irritation. That's why you're tearing.
Yeah, exactly. So persistent tearing past the day, then you should also be making your way to the eye doctor as well.
So that's fantastic. All right, so we talked about protective eye gear. We talked about making the three signs that if there's an eye injury, three signs that you need to get it checked out immediately. Don't delay. We also talked about computers and screen time in terms of blinking and making that 20-20-20 rule that we can enforce. And so these are all some wonderful, wonderful tips to reduce the eye injuries. Now, there's some things that aren't preventable, like the 3-year-old starts pulling on the dog's tail and the dog turns around and says, you can't say it, but let go of my tail. Dog bites, but we have to reduce lift. Another thing we talked about was putting those dangerous chemicals not under the sink like we used to, and that we were raised to, but putting them on a higher shelf in the laundry room or in the garage, putting them away to where children can't just grab and get into it. We also talked about if there is some sort of chemical injury. This is something I really learned tonight. You can use any type of liquid that's ingestible to flush the eyes out. You don't need to go run around looking for water like they do in the movies. If you got some Gatorades, as my mom said, Coca-Cola, something to flush the eye out. We've got to get that eye flushed out as quickly as possible, because the more time, as Dr. Rutter said, the more time that chemical stays in the eye, the more damage could be done, not only to the eye, but to your vision as well. So we've got to flush that out as quickly as possible. Also, as Dr. Carter talked about, that pressure to the eye on the exit around the eye, we're trying to keep it, our bodies are wonderfully designed. That's why our eyes kind of sit back and there's this nice bone that goes all around it. And that's all for protective measures. But there are objects and things that can happen to damage that and put that pressure on it. So we have to make sure that when those things happen, look for those symptoms that he talked about. Go see the specialist. So final question as we're wrapping up here. Final question. How often, even in the absence of injuries, how often should somebody be going to see an eye doctor? Or two-part question. And if there is an injury, what type of eye doctor should they be seeing? Is there a specific type, or they should be seeing any ophthalmologist if there's an injury?
Great question. I was actually going to say, so if you do have an eye injury, and let's say you're lucky, you avoid any permanent loss of vision. For example, let's say you had some bleeding in the eye, but it resolves and your vision's back to 20/20. You still want to see an eye doctor every year, because there are some long-term risks after trauma that we can detect that you might not. For example, glaucoma, which is a disease that does affect our population more. It can happen over time after a significant trauma. We mentioned, the baseball hitting the eye, so that there was significant damage that can be done to structures in the eye that puts you at risk for a disease like glaucoma, and you won't have symptoms. So it is important, if you have a serious eye injury or have had one, to see us every year for your checkup. Can also lead to earlier development of cataracts, which is when you have clouding of the lens, and which you will have symptoms for that. But again, for glaucoma, you won't have any symptoms. And then in our population, we do recommend an eye exam over the age of 50, because for screening for glaucoma, because we have a higher risk.
Yeah, in the community. Dr. Carter, anything, or you're concurring on Dr.
Great. I think anytime you had an eye injury, you need to have follow-up at least once a year until you're stable. And again, as you get older, I think you need to touch base with your eye doctors, because there's diseases that can occur in the eye later on that totally don't give you any symptoms, and they can do a lot of damage before they're picked up. But if you pick them up early enough, they can be treated and prevent you from losing vision.
Exactly. And then you mentioned what type of eye doctor to see. So ophthalmologists are who you want to see in the case of significant eye injuries. If you go to the emergency room, not all emergency rooms have an eye doctor readily there waiting to see you. As if you came to our trauma center, we do have an eye doctor who's there all the time, 24/7. But if you go to a place where there's no eye doctor, they may send you to one first thing the next day. They often call them on the phone to sort of talk with them about whether they need to come in to see you or not. So, but when you have a significant eye injury, you want to make sure you're not only seeing the emergency room doctor, but that you do see an eye doctor, usually within 24 hours.
Just to crystallize what we were talking about with eye injuries, we had a comment from our YouTube went on our YouTube watch it. Her nephew was hit in the eye playing baseball years ago as a child. He was hit in the eye causing severe damage, which we call a dead eye. And so that's what you don't want to have happen. And so protective eyewear could have significantly reduced or prevented that injury from happening. Even with I know with hit balls, especially the force can sometimes still cause injury, but those goggles can protect and prevent that dead eye from happening. So those are real. This is real, people. We're talking about as real as it gets, and so we know we like to see.
And lastly, if your nephew, for example, you said now he only has one good eye, so thank goodness we're given two eyes. So as I mentioned, if you have a significant eye injury, not only do you want to see the ophthalmologist every year, but you want to protect his one good eye. So if you've had a serious eye injury that has unfortunately affected the vision, it's even all the more important to wear the protective eyewear. And actually, if you have a serious injury affecting the vision, we recommend that you wear the protective eyewear all the time, just because the risk if something happens to the one good eye, the risk of being blind is too great to take. So I recommend in all my patients with a significant eye injury in one eye to wear the polycarbonate glasses that are shatterproof all the time, no matter what they're doing, to ensure that we are protecting the one good eye that will enable him to see for the rest of his life.
Absolutely.
I agree with that totally. And we can find some cool frames. Don't worry. We can find frames that are cool enough to wear. The important thing is polycarbonate lens in front of that eye to protect it. You only have one left after you damage one.
Exactly. And a lot of times we're so focused on the bad eye that, we may forget the good eye. So that's why it's important to remind our patients of the importance of protecting the one eye they have left.
If I can make one addendum is that also diabetes is very, very high in our community. So you also have to go see the ophthalmologist annually to prevent diabetic retinopathy, which is a very, very serious condition, and I think it's the second leading cause of blindness in African Americans. Is that diabetic retinopathy,
and it's treatable.
And it's treatable. Very, very treatable. So if you have diabetes, if you're pre-diabetic, go see it. And sometimes, and I learned this from Dr. Coney, sometimes they can tell if you're pre-diabetic before you even know it by just doing an eye exam. So leading up to that, if you feel like if there's a history of diabetes in your family, go get an eye exam, and they can start seeing some things, because the eyes are very, very it's a very, very fascinating organ, and it can create other vessels to circumvent problems. But those vessels can shred and lead to blood pooling. See, look, I've been learning.
Absolutely. So for trauma, prevention is key for diseases like glaucoma or diabetic retinopathy, where you may not have any symptoms. Screening is key. So you have to come to us.
Go get it. Go get your eyes dilated. Polycarbonate. What's the type of the lens?
Polycarbonate.
Polycarbonate lenses. Go get it. Make wearing eye protection cool, right? We can make it cool ourselves. We don't have to, the athletes would help accelerate that. The sports leagues would help accelerate that. I got my glasses right there. I got some reading glasses right here somewhere. But the athletes will help that. But let's start our own movement and just say, hey, we're gonna protect our eyes, love our eyes. If you watch us on the replay, just put hashtag love your eyes, and we're gonna do that.
Well, it was a great opportunity to join him.
Thank you so much for the opportunity and for tuning in. Any closing words, Dr. Carter, before we?
No, I just think we emphasize what we talked about this past hour. Protect your eyes. Make sure you don't ignore symptoms of pain, redness, decreased vision. And with everyone's help, we can prevent a lot of these eye traumas that we see. And I want to thank everybody for joining in tonight. It was a pleasure to join you and share the stage with my friend here. And till next time, good night.
Good night. Thank you.
Well, again, sorry, that is technology, and that's what happens. So I want to say thank you, Vicky, for that. We apologize for the technical difficulties, but wonderful program. We're going to re-air this tomorrow so people can get some more of this great information. I want to thank our guests for joining us. Thank our partners at the Children's Vision Equity Alliance, as well as at Prevent Blindness and the National Eye Institute. Thank you for this series. This is called Seeing Eye to Eye. So we'll see you all. We've got another program on child's health on Tuesday, and then we'll see you all again in the future. Thank you so much, and y'all have a wonderful evening.